Hello, everyone. Welcome to our webinar, What Your Vagina Wants You to Know About Lubes. We're going to give folks a few minutes to get logged on to the meeting and get settled. But in that time, while that happens, please feel free to utilize the chat, put your name, your pronouns, if you're calling in from an organization, who you're representing, and then also where you're calling in from. And we'll get started shortly. And as we wait for folks to come in, just wanted to go over a few housekeeping items. So please make sure to update your name on Zoom. I think it's super helpful for us to see who's in the room. Also, this Zoom is set up for you all to have the capability to come off of mute. However, we kindly ask that during the presentation, you just make sure that your microphone is muted so that we don't interrupt any of the presenters. I know we had a few requests for closed captioning, and if that is something that you would like to be a part of this meeting, you'll have to turn that on in your Zoom personal settings. Right in the bottom bar, all the way to the right, there is a show captions option. Um, and then also wanted to mention that this webinar will be recorded and we will share said recording after this webinar is done. And although we encourage folks to have questions, obviously throughout, we will have a question and answer section at the end of this presentation. But if you have any questions that come up while we're chatting, just be sure to put them in the chat and we'll make sure to address them at the end. And then also we encourage you all to keep the dialogue going in the Zoom chat. So super exciting to be here with everyone today. So I am going to go to the next slide and we can get things started. So welcome everyone. We are gathered here today to talk about what your vagina wants you to know about lubricants. This webinar is an activation for this year's Vaginal Health Week, which kicked off on Monday, October 20th, and is being observed throughout the week until Saturday, October 25th. So I'm excited to share more with you all about the legacy of Vaginal Health Week and this annual week of advocacy and what we have to look forward to. But before getting started on that, and you can go to the next slide, I have some really exciting news to share. Um, so, Women's Voices for the Earth, which I think most of you know us as, has rebranded, and we are now Weaving Voices for Health and Justice. Our new name centers those who are most impacted by the issues that we address, and it also reflects the communities that we advocate and do this work alongside of. It's more than a new look, it is a strategic evolution that better aligns with how we present who we are, what our values are, and the work that we do. So it strengthens our fight towards an equitable and healthy future free from toxic chemicals and also honors our 30-year legacy as well. So not only are we having a rebrand, but we are also honoring and celebrating 30 years of doing this amazing work. So for those of you who have been with us throughout the last 30 years, allow us to reintroduce ourselves. And if this is your first time engaging with our organization, welcome. And we look forward to continuing our work in our three main programmatic areas, which are menstrual and intimate care, safe cleaning, and safe salons and beauty. So, welcome to Weaving Voices for Health and Justice. My name is Jayla Burton, and I am the Director of Program here at Weaving Voices, and I will be joined today by Alex Scranton, our Director of Science and Research, who will share more about lubricant safety. And just wanted to acknowledge that this work and all the work at this org could not be done without our amazing team, which is pictured and named here below. Next slide, please. I would also like to acknowledge that although our work is national in scope, we operate on land unjustly occupied and taken from the Nuchu, Shoshone, Apache, Cheyenne, and Arapaho tribal nations, which is also known as Denver. I'm calling in from Ohlone land in Oakland, California. And yeah, we just want to like to do our land acknowledgement before we start any order of business here at Weaving Voices. Next slide. So, what we'll go over today is talking about Vaginal Health Week, in which this year's theme is healthy vagina or happy lubes, or healthy lubes, happy vaginas. So, we will briefly talk about the vaginal microbiome and intimate care products as a whole, the science about how people are harmed by lubricants. We'll learn a little bit more about pH, osmolality, and other harmful ingredients that are in loops. We'll also take a look at the regulation behind it all. And then finally, we will be unveiling two new resources to help folks make informed and conscious decisions about the lubricants that they are using. And like I've mentioned in the beginning, we will have a section for question and answer at the very end. So next slide. So welcome to Vaginal Health Week. Vaginal Health Week is a movement to break stigma, bring visibility to often overlooked topics, and advocate for the rights of people with vaginas, as well as those who care about them. Over the years, we have brought attention to many gaps in menstrual and intimate care, while also calling for collective action to improve the standards that shape vaginal health more broadly. So this year marks our fifth annual Vaginal Health Week. And we are also thrilled to announce that Vaginal Health Week is officially being acknowledged in the city of Denver, which is a powerful recognition of the importance of advancing vaginal and reproductive health for all. So that is what you're seeing pictured in this slide. And if any of you are interested in bringing this recognition to your city or state, or even on a national level, we would invite you to join us in that movement, and please let me know. And we would also like to thank all of our endorsing partners for this week, who are also listed on this slide, that are doing this work alongside us as well in each of their areas, and also helping to support and promote all of the activations that we are doing this week. Next slide. So, jumping into the meat of why we are here today, I wanted to kick us off with a poll. And I think that, Deborah, you might have to prompt the poll option for everyone. But as that comes up, just wanted to propose a poll and see where folks are feeling about what factors do you think most influence who uses lubricants and how often.
So everyone's seeing that.
Yes, thank you, Deborah.
Great.
And so we have option A, which is age or lifestyle, B, sexual orientation or type of sexual activity, C, access to healthcare or information about vaginal health, D, marketing and product availability, and then E, all of the above. I'll give folks a few minutes to answer. Awesome. And if we want to go ahead and publish the results of our poll, great. Okay, most of you all said all of the above, which is absolutely correct. And we will learn a little bit more about each of these issues like as we move through the presentation. We'll talk about how lubricants can be used to manage vaginal dryness that can be caused by allergies, medications, cancer treatments, or other hormonal changes. Also, lubes are used amongst those who are regularly sexually active, regardless of sexual orientation. Lubricants are also used in the medical setting by health professionals exams, whether that's for intravaginal, transvaginal, or anal rectal exams. Today we will be focusing primarily on personal use lubricants. So those are going to be the lubricants that you find on our shelves. And then lubricants can also be advertised to helping maintain a healthy pH or organic or toxic free. So we'll talk about those things today as well. But it's great to see and hear that everyone kind of is acknowledging all the different ways in which lubricants can be used and by who. Our next question, which I'm going to encourage folks to answer this in our chat, is what barriers do you think exist for people trying to find safe bodily or body-friendly lubricant options? So feel free to answer and utilize the chat to share your thoughts. Yeah, I'm seeing folks say the toxic ingredients that are in some of the lubes, the lack of information. I think one of the reasons that we are hosting Vaginal Health Week is to name some of the issues with vaginal health, and it has typically been seen as taboo. If people are not talking about vaginal health, aren't comfortable with even using the language, how are we going to talk about, some of the harmful practices or products that are surrounding vaginal health? So that's definitely like lack of information and also just lack of folks talking about it as well. A lack of product diversity in stores, a lack of education through providers, and then price. Awesome. Yeah, those are all very valid barriers that we face when, deciding what lubricants to use. So all of these things we will likely talk about as we move through this presentation, and I'm excited to pass it to Alex Scranton, who is our Director of Science and Research, to share more about vaginal health in the context of lubricants. So take it away, Alex.
Thank you, Jayla. Absolutely. And yeah, and thank you for putting up that poll and getting people kind of, starting that conversation, thinking about the way people use lube and what might affect the way, how they choose a lubricant product. And I love the sort of like people being clueless about chemicals. We'll talk about that and how to be less clueless about some of these issues. You also, Jayla, mentioned stigma, and I'm really glad you sort of mentioned that as a key issue. Because it's, to bring it home to Vaginal Health Week, why are we talking about vaginal health in the first place? And it's because we often don't talk about vaginal health, right? As a society, we tend to discourage people from talking about vaginas, but from talking about vaginal health. And that's really exactly why we're here this week, to do the opposite and to celebrate these things. We've talked, there's the stigma about not talking about vaginal health. And that means that vaginal health isn't discussed often. It also means it isn't researched very often. There are very few research dollars that go into vaginal health. And it also means there's very limited resources or education on the prevention of vaginal health problems or even the general promotion of vaginal health. So people have asked us, like, if doctors aren't talking about this and public health people maybe aren't talking about this, is vaginal health actually all that important? And the answer is a resounding yes. Vaginal health is actually very important. It's crucial to your overall health as well. So I want to talk about three basic needs for vaginal health. The first is you need intact, undisrupted vaginal skin, right? So you don't want no rashes, no infections, no irritation. This is very important for vaginal health, to have that intact skin. The second is healthy mucous membranes. You want, as much sort of moistness there, good intact membranes, no dryness, that kind of thing, for the best health. And then the third is a healthy vaginal microbiome. And this is the unique community of healthy bacteria that inhabit the vagina and only the vagina. It's different from anywhere else on your body. Very, very key to your health. Okay, let's go to the next slide. So yes, the importance of vaginal health. Why are these sort of three factors I was talking about so important? The first is healthy intact skin and then healthy, moist mucous membranes. This is your first line of defense. It physically protects the vagina from harm. It can protect it from infectious agents, from sexually transmitted diseases, from overgrowth of yeast, from chemical exposures as well. So it's really that first line of defense. Very important that these things are intact so these other, dangerous things can't get through to vaginal tissue. The healthy microbiome is also very key, and we're learning so much more about this. Just in recent years, there's been a ton of research on this. Now, everyone's vaginal microbiome is slightly different, kind of like our gut microbiomes are all a little bit different. But we found out that the healthiest microbiomes are those that are lactobacillus dominant. That's a particular kind of healthy bacteria, and you want your vaginal microbiome to have mostly lactobacillus and kind of drowning out some of the other negative bacteria that can be in there. What lactobacillus do, they're kind of magic. They can do all kinds of things. One of the things they do is produce lactic acid, right? So it keeps the pH in the vagina very low and acidic. You've probably heard about vaginal pH before. You don't want that going off the rails. Lactobacillus is keeping that nice acidic environment. When you have the nice acidic environment, this helps to prevent the overgrowth of these unwanted harmful bacteria. It prevents the overgrowth of yeast, which can cause yeast infections. It can actually also reduce your susceptibility to sexually transmitted disease transmission if you were infected, right? Now, however, if the bad bacteria do take over your microbiome and lactobacillus declines a great deal when this happens, everything, like all kinds of your health, particularly reproductive health, can go off the rails. And this is, again, science that they've really done in the most recent years. They have linked a disrupted, unhealthy vaginal microbiome to all kinds of reproductive harm. So if your microbiome is messed up, you are much more likely to have pelvic inflammatory disease, or PID. You're certainly much more likely to have bacterial vaginosis. That is kind of the basis. Having a messed up microbiome is what's causing that bacterial vaginosis. If you are pregnant, you're more likely to have a preterm birth if your vaginal microbiome is off, or to get preeclampsia, which is a serious pregnancy condition. Folks who are diagnosed with vaginal and vulvar cancers, again, way more likely to have a messed up vaginal microbiome. We're finding these connections. So the microbiome, along with that intact skin and mucous membranes, these are all absolutely key to good vaginal health. It's just not something that, sort of publicly we talk about very much, or even sort of emphasize from the standpoint of prevention. Okay, let's go to the next slide. Let's get into lubricants, which is why we're here today and how these things are related, right? First of all, I just want to talk about what are lubricants, so we are all on the same page, right? A lubricant is a vaginally applied personal care product used to reduce friction and offset vaginal dryness. Now, as Jayla was saying before, these are used for a variety of reasons, most sort of commonly associated with sexual activity, but also with moisturization. This is often associated with vaginal dryness that happens naturally with menopause, with hormonal changes. There are also medical protocols, particularly after gynecological cancers, that require the regular use of lubricants. There are medical procedures, your sort of annual exam, which might involve using lubricants. But what we don't often realize when we think about all this lubricant use is that lubricants are a direct source of chemical exposure, both to vaginal tissue and to the vaginal microbiome. So it's this product with real direct contact with some pretty sensitive tissue. And what recent science is showing is that some lubricants, not all, but some lubricants can actually significantly harm vaginal tissue even after a single use. Like, I've seen these studies and they show kind of before and after exposure to lubricants, and you get these microscope images of vaginal cells, and you can literally see the damage and deterioration after a single use for some lubricants. And this should not be allowed. It's just not a good idea. Amazingly, we don't have regulations that actually require lubricants to be vagina safe in this way. All right, let's go to the next slide. Okay, so talking about how some of this harm is done from lubricants, and I apologize, I'm going to get a little sciencey on this slide. I might make you recall your high school chemistry class, which may or may not be a good memory, so sorry for any of that. There are two factors of lubricants that are most commonly studied when it comes to vaginal lubricants, where we have a pretty good idea of kind of what's going on and how they're affecting our bodies. Now, the first is pH. You may remember pH. It's kind of the measure of how acidic or alkaline a product is. You might remember little pH strips from chemistry class. What we know is we want to keep the vaginal pH stable, and we want it to be acidic, and we want it to be low. So your best bet is to have a lubricant that matches the natural pH of vaginal fluid, and that's a pH of between 3.8 and 4.5. If you have a pH, for example, that's much too high, it has the potential to throw that pH off. Not something you want to do. You want it to be as compatible as possible with what's already there in the vagina. The second factor is osmolality. This may be a slightly less familiar term. You might remember the term osmosis, which is what that little diagram I have. It's a measure. Osmolality is a measure of the ability of a substance to absorb or release moisture. So with osmosis, kind of moisture goes, back and forth across a membrane. Now you want your lube to have an osmolality below 380, right? Now 380 is the osmolality of the vagina, of vaginal fluid and vaginal cells, right? This means the moisture flows in the right direction. You want moisture coming from the lubricant to go into the cells and keep them nice and hydrated, keep those mucous membranes moist. When the osmolality of a lube, on the other hand, is too high, the fluid goes the other direction. It's the reverse, where you're actually getting fluid pulled out of vaginal cells, pulled out of those mucous membranes, and absorbed into the lubricant, drying out, seriously damaging these smells. So we've seen this in numerous studies looking at high osmolality lubes, where you have these vaginal cells, even on one exposure, that are just shriveled up, leaving that disrupted vaginal skin barrier that I was talking about, which is so important to prevent things like infection. Unfortunately, there are still lubes on the market which have these incredibly high osmolality values. Again, the lack of regulation requiring this. Okay, next slide. Okay, so if pH and osmolality aren't bad enough, we also looked at the ingredients we find in lubricants. We looked at 100 different lubricants on the market and what their ingredients were, and highlighted some of the problematic ingredients we found. They're not present in all lubricants, thankfully, but they are in some. The first I want to talk about is parabens. You've probably heard of parabens. Parabens are preservative chemicals. We're talking about water-based lubes, and water-based lubes need some sort of preservative to make sure they're not growing mold in the package, right? But parabens are not the best choice. Parabens are potential hormone disruptors. We don't need to be adding hormone disruptors to the vagina. They're also known to cause vaginal irritation. Again, we don't want to disrupt that vaginal skin. We have better preservatives that don't do these things. Manufacturers need to be making better choices and not using parabens in their lubricant. The second ingredient of concern is this chlorphenesin. This is actually a really potent antifungal and antibacterial chemical. I was surprised to see it in the ingredient list for some lubricants. It actually gets used sometimes occasionally to treat vaginal infections, kind of like a potent medicine when you've got, infections out of control. It's just not appropriate for healthy tissue. It's really, really potent stuff. And we talked about the importance of the vaginal microbiome and keeping that stable. You don't want to add a chemical to your vagina that might kill off some of that good bacteria. So again, this is totally unnecessary in a lube and an ingredient that can be avoided. The third category is these capsicum extracts. This is basically the juice of hot peppers. I've got the little hot pepper thing. You find these in kind of warming lubes. That's kind of one of the bells and whistles that you see in lubes sometimes, meant for a little fun, a little extra tingle. That little extra tingle can also lead to extra burning, stinging. These are signs that your vaginal cells are actually being damaged. This is not a fun aspect. It can actually cause some serious damage. And we talked about the importance of that intact vaginal skin layer. Well, capsicum extracts have the capacity to erode that skin layer and doing real damage. So again, a really unnecessary bells and whistles to some lubricants that are simply not vagina friendly. And shouldn't be exposed to them. And then the last is fragrances, undisclosed fragrances or flavors. If you've been to any of our webinars before, you have heard me say this before. It's one of the issues that we talk about. And if you're interested, all of our previous webinars are on our YouTube channel, so feel free to check those out after this one is done. We talk about fragrance because fragrance and flavors, it represents this black box of chemicals, right? That's what the term you see on the ingredient list, but you don't know what's in it. With lubes, it's more likely to say flavors than fragrances. Again, very much the same sort of chemicals. Numerous chemicals of concern which can be kept secret from you by just calling them flavors. So they could be carcinogens, they could be reproductive toxins, they could be allergens, they could be irritants. Again, you want to know what you're being exposed to. You don't want these undisclosed ingredients. And again, it's really an completely unnecessary bell and whistle, for lubricant. Best to avoid it and choose something simpler. All right, let's go to the next slide. Okay, so I think I've kind of talked about this as I've been talking, the general weaknesses of lubricant regulation. There is almost no regulation in the US requiring lubricants to be vagina friendly. Nothing that looks specifically at the requirements of what the vagina needs and what might impact vaginal health. Now, most lubricants are actually regulated as medical devices by the US FDA. This does mean they submit a pre-market notification kind of form. It involves a little bit of science that they have to present. It's largely kind of a rubber stamp process. And again, there's nothing in there that is really relevant to what we've talked about today. There are no rules or requirements requiring appropriate pH levels, requiring appropriate osmolality levels. They're not even required to tell you what their pH and osmolality levels are. And then there are no requirements that assure us they're not using ingredients that are potentially damaging to vaginal health. So there's very little oversight in the lubricant market today, which is why we still see such a variety on the market. I just want to address one note that came in questions when people registered for the webinar. They were asking about European-made lubricants. Now, in the European Union on the whole has much stronger regulations, particularly for chemical safety for consumer products. And in this, the work that we've done, we haven't looked at European products separately or specifically. They are likely to have better and safer ingredients because of all the work that's been done on chemical ingredients, much less likely to have parabens, for example, as preservatives. Those are largely pulled from the market. But I've not heard of any European regulations on pH or osmolality. I don't believe it's anything that they've actually taken up, so there's no sense of they necessarily would be safer on those categories. Okay, let's look at the next slide. So here I wanted to zoom out a little bit and talk about the big picture of cumulative impacts and kind of the health equity angle. Our focus this week is on lubricants, and that's what we're diving into specifically, but you can't just look at these things alone. There are many factors affecting vaginal health, and certainly from an equity standpoint, we have to recognize not everyone is affected in the same way. There are definitely disproportionate impacts on vaginal health in some communities over others, and this leads to greater health disparities in some communities over others. And some of this is maybe coming from the more or less prevalent use of vaginally applied products, even in addition to lubricants. So the work that we've worked on 3 types of vaginally applied products, focusing, for example, lubricants, and then intimate care products, which are wipes and sprays and douches and powders, and then menstrual products. These all entail chemical exposures directly to vaginal tissue and to the vaginal microbiome. They all have the potential to then impact your vaginal health. Now, if you end up having adverse vaginal health from any of these, your risk of diseases and conditions rises considerably, as I've mentioned before. So it's worth reiterating that there are some populations, communities that are at greater risk than others, in part due to more prevalent use of vaginally applied products. Now, there may be more use of lubricant in the LGBTQ population. There's not a lot of data there, but we've seen some data indicating that. There may be more lubricant use by age. If you are older and in menopause, you may have a greater risk there. We know for intimate care use, Black and brown communities are much heavier users of these products, meaning their vaginal health may be more impacted even before lubricant is kind of added in added into the mix. So yes, it's worth remembering that we do this work in recognition of all these factors, and we does work especially to protect those who are disproportionately affected. Let's go to the next slide. Okay, so here is how to find a safer lube for the vagina. If I haven't already loaded you up with all the bad news on lubricants, the good news is there is something you can do and that better options do exist. And it's just a matter of finding the better options. When we started looking into lubricants, this is a number of years ago, it was tricky because it was very easy to talk about the problems. It was really hard to provide good solutions. We did not have the information we needed, particularly on pH and osmolality of a huge variety of products that could be useful. So here we now have two fabulous new resources. The first is our fact sheet. There are links in the chat. The QR code is right there. The fact sheet encapsulates much of what we've told you today. So if you don't remember it all, it's there for you. If you want to tell your friends and family about what you learned today, but you can't remember the details, we've got you covered. Download our fact sheet, and it is all there. The second is our brand new database, which is we release kind of as we speak. You guys are the first folks seeing it publicly. For this, we looked deep into the FDA website. We found that companies were actually disclosing their pH levels and their osmolality levels to the FDA when they submitted these kind of pre-market notification forms. Now, these forms are way buried on the FDA website. It is not at all meant to be user-friendly for the average customer, but we pulled all that data for you and put it into an easy-to-read database of brand names. So maybe I'll ask Drea just to show us the database quickly. Okay, so this is what it looks like. If you sort of scroll down, you'll see we've rated them kind of the best lubricants by the best pH levels and best osmolality. We have a section of highly recommended. These may like slightly range outside some of the ranges, but they're mostly in the good ranges. And so we also find them to be very highly recommended. Then as you scroll a little further, you'll see that it gets to the red text. And these are lubricants that are failing to meet our safety standards. Either the pH is much too high, the osmolality is much too high, or the pH and the osmolality are both much too high. And these are ones that we are not recommending. You can also download this as a PDF, or you can see the ingredients, which we've highlighted the products that have some of those problematic ingredients as well. Okay. Let's see. Yes. Okay. So here are the QR codes for that as well. And please feel free to share. Now, as far as finding a lubricant that works for you, just be aware this is a very personal decision. There are lots of other sort of factors of lubricants that work for some bodies and not others. You have to trust yourself. You are, in fact, the best judge. We hope that both the fact sheet and the database will help guide you towards some better choices, but you really need to pay attention. You need to listen to your body, figure out which lubricants are working best for you and which might have some symptoms that you're like, that feels a little off, right? Try another one, see if you can make these symptoms go away, and find one that works for you. But really, trusting yourself, listening to your body is the most important tool that you have for finding that. I think that I realize there were a couple questions that came in. Maybe we'll get to the question and answers in a minute. Okay, I think that wraps everything. My slide. I'm gonna shoot it back to Jayla.
Yeah, thank you so much, Alex, for kind of sharing the background behind the lubricant database. And one of the other things that I really wanted to mention is that, and I think you said this, but it's not an exhaustive list. Like we don't have all of the information about all of the lubricants that are on the market. And so that's just one of the things that I wanted to elevate and make sure that you are aware of. And then also we are going to do our best to update this list as as companies and manufacturers like come to us and figure, wow, that organization is really calling folks out in terms of where we are standing with our pH and osmolality. So this is a living database that will be updated, and we encourage folks to use it because there really isn't like a lot of disclosure and transparency. Like if you do go to the store and you pick out a lubricant, you're not going to see the pH It's very, I think I've seen one. And that's not to say that that's the only one that exists, but just speaks to the limited transparency and disclosure of pH and osmolality levels in lubricants that are on the market. So I also wanted to just give flowers and say that this was a database that was helped pulled together, obviously led by Alex. And then we also had one of our Weavers fellows from our last year cohort do the heavy lifting of like going through the pre-notification data on the FDA website to be able to bring this database to life. So we will get to the questions soon, but I just wanted to, if you want to go to the next slide, I wanted to invite folks to share if you've experienced any health issues after using lubricants, that you could share that experience with us. I know it is very uncomfortable to be able to do that, but also there isn't a lot of information that we have in terms of like people talking about this. So we encourage you all to share if there is anything that you've experienced personally. And obviously there's an option to share anonymously. And what we do with that is it just kind of helps us develop our advocacy efforts. So if there's any brands that you want to call out or you have any questions about or anything like that, I encourage folks to share your experience with us. In addition to sharing, we're going to flip it back on you all and say that if this is a tool that you could see being used in your community or just anyone that you know, friends, family, organizations that you all are connected with, we do encourage folks to share not only about Vaginal Health Week, but about our two resources that kind of like summarize what's going on with lubricants and then also the database, which really gives the power back to us in terms of the conscious decisions that we're making as consumers. So those are just two things that we would love for you all to take away from this webinar today. And then I know I've seen a few questions come in, so let's transition to Q&A. And I'm gonna kick us off because I know we had some coming in, but it looks like, and maybe I can ask the question, and if Alex, you want to answer it, I think that could be a good flow.
Yeah.
Um, so it looks like we had maybe, I think, two questions in the chat that were specifically trying to get a better understanding of the osmolality levels and what is the ideal osmolality of a lubricant? And maybe you could talk a little bit about the ideal pH for lubricants within that as well.
Sure. Yeah, no, these are really good questions. The general guidance is that you want that osmolality lower than 380. And again, it's just so that the moisture is flowing in the right direction, like into the cells as opposed to away from the cells. So it doesn't really matter how low it is below 380. It's not, it's just, your cells aren't necessarily going to get kind of overloaded by the sense of lubricant. So generally the guidance is below 380, anywhere in that range is going to be just fine. With pH, you want to be in that 3.8 to 4.5 range. Much generally what we've seen is lubricants with much higher pHs that are more basic or more alkaline, and that can, take away from the acidity. I don't think there's a lot of research on lubricants that are very much lower than that range. I've only sort of seen, I think there was only one or two that we've seen that were kind of lower, and there's just not good data on like what happens if it's too acidic, and can that throw anything off? Very unlikely to be super, super acidic, because I think that would be initially, immediately painful, and no one's going to buy that product. So I think the problem has been more that we were seeing those higher pHs, which are unnecessary.
Um, Thank you. And then I think the next question that I see is on our database, is the rating using the same system as EWG Skin Deep database?
Oh, that's a really good question. The Skin Deep database is a great resource. If you have not seen that, you can Google EWG Skin Deep, which rates cosmetic products from like a 1 to 10, based on what their ingredients are and how safe those ingredients are. Our rating system is entirely different, and it doesn't. We've just sort of rated them kind of to put them in categories. Within each category, like 1 is our highest rating. These were the generally the lubricants, gave us a range of pH and a range of osmolality, and we wanted to make sure like the entire range was underneath 380, and then the entire range of pH was within that 3.8 to 4.5 window, and that got a rating of 1. So within that, rating of one isn't necessarily better than the other. They're all, kind of in there. In our highly recommended, generally, the range was mostly within those ranges. Maybe it's strayed, particularly with pH, maybe it's strayed either higher or a little bit lower, but we're still largely in those ranges. So that got a rating of 2. But so very unrelated to the chemical ratings in Skin Deep, but 1 was kind of the better. And then as you go down, you see the text turns red, and you sort of 4, 5, and 6, the ones at the bottom, are the ones that have both much too high osmolality and much too high pH as well. Yeah, a great question.
Yeah. Okay, our next question is, and I think I saw this when folks were registering as well. So I'm gonna try to pad this question with some other common questions that I think that we get when talking about lubricants also. So this one specifically from this webinar was, are there any natural-based lubricants that are plant-based rather than chemical-based? And I think in addition to that, I think we sometimes it comes up as like coconut oils or olive oils, are those better alternatives as opposed to like some of the more water-based or silicone-based lubricants?
Yeah, these are great, great questions. And it's really great that people are thinking about all these different, alternatives. Now, as far as are there natural-based lubricants, most of the lubricants, I'm trying to think, I suppose there are. I'm thinking about the ingredients that were, in the products on the list, and you can certainly see the products. We found a range within all, I think probably almost all levels on our database. So I don't know that plant-based versus more sort of chemical-based, the pH and osmolality can still be really different with both. I think the oil-based lubricants are using something like olive oil or coconut oil. As I say, there's very little in the way of safety, published safety testing of those, so it's a little bit hard for us to make a recommendation. I do know one of the issues with those, I've certainly heard anecdotally, a lot of people have great success with those when they haven't had success and get sort of irritated by lubricants that are on the market. The one very important caveat is that any of these oil-based lubricants should not be used with latex condoms because they can actually deteriorate the condom. And then, of course, that sort of defeats the purpose of the intactness of the condom. So that's one warning that those sort of oil-based, olive oil and coconut oil should not be used with latex condoms. But for other, just vaginal moisturization, or if you're not using condoms, then they might just be fine, but there isn't a lot of research to back it up one way or the other. And of course, I don't really know as far as lubricants that contain those, as far as pH and osmolality, I don't have that information either. But we've heard some good things from people about those being successful. And again, that's definitely a situation. Listen to your body, and so trust your experience. Yeah.
Mhm. Well, maybe I'm going to insert a question for myself, but also I think that we get a lot as well as like water-based lubricants versus like silicone lubricants. So maybe you could share it because I know if we're talking about lubricants in the context of which ones are chemical free or which ones are natural, like it's probably also important to mention the silicone that properties of those lubricants as well.
Yes, no, that's a really good point. I should have had it in my slides. I mean, we do have a blurb on this in the fact sheet. So our database and our research was largely on the water-based lubricants, because when you have a silicone-based lubricant, it has no water in it. Because it has no water in it, you can't really measure pH, and osmolality is just sort of not a thing because it's more inert and it doesn't cause kind of water flow one direction or the other. With silicone lubricants, they're a little bit tricky as to whether or not we can recommend them. They're largely include ingredients which are these siloxanes. Some of these siloxanes have been banned in Europe from cosmetic ingredients, partly because they build up in your body, partly because they build up in the environment. So there's definitely some red flags on the siloxanes. Potential reproductive impacts, that those are still, the jury is still out a little bit on those. So definitely some potentially questionable ingredients. Of course, some people, prefer those. It's a very different feel to water-based lubricants, but it's a little bit hard to recommend one way or the other. But we don't, there isn't data on pH or osmolality on those because of the way they're made. You can't sort of measure those factors. So they're likely not to have the pH problem or the osmolality problem, but they could have these siloxanes, which could be questionable ingredients. Yeah.
Okay. Awesome. Thanks, Alex. Okay, I'm gonna go back on track and get some
Great
questions
question.
from our
Yeah.
participants. There was a question about recommendations on vaginal suppositories for postmenopause, and do they really rejuvenate vaginal tissue and moisture?
This is a really good question that I wish I had the answer to. I've also seen these products. Um, cannot find good science on these products. It's really, really hard um, to say how effective they are as opposed to just sort of like a marketing technique. We've done some work recently looking at different kinds of vaginal suppositories. Like a lot of them are kind of these boric acid suppositories, which are marketed as odor control products. There is absolutely zero evidence that boric acid has anything to do with odor control. We do know boric acid is very dangerous to vaginal tissue, very dangerous to the vaginal microbiome. It's only to be used if you have already a persistent vaginal infection that won't go away and other things haven't worked. That's the only time that boric acid suppositories are going to be effective. But there's a lot of products out there that are looking towards the postmenopausal community because when you're in menopause, your estrogen goes down. This hormonal change does lead in many people to vaginal dryness. So people are looking for solutions to that. So it's kind of a logical thing like, oh, well, if you have a suppository and it's putting something in the vagina to add moisture, that sounds right. But again, like what the osmolality are of these suppositories would make a huge difference as to whether or not they're gonna work. But there isn't, again, there are not, it's, one of these things, people don't study these as well. The companies making them are not publishing their data. So again, I wish I had a better answer for you. But again, trust your body in terms of how it feels. I mean, one of the things that we've thought about with people using lubricants, particularly for vaginal moisturization, is if they happen to be using a high osmolality lubricant because they're feeling vaginal dryness, and then it actually causes more vaginal dryness because it's got the high osmolality, then you might think, I'm not using enough lubricant, I need to use more, right? So it can be this vicious cycle if you're using the wrong lubricant. So if that sort of thing is happening, by all means change the product, try something else, look on our database for a less, lower osmolality lubricant that will hopefully stop, that vicious cycle. So
Awesome. Um, and then I think there was another question about on our fact sheet, since they are public, is it allowed to be printed and shared with different patients or used at educational events? Yes, I think that is one of the main reasons that we wanted to have this webinar today is to share, make sure that you all understand kind of what the issue is with lubricants so that you're able to pass this along to the communities that you serve. So you should be able to download the fact sheet and it can be in a printable version as well and share that widely. And if you would like to share the link to our database, we do have a digital toolkit that has language for how to share it. If you want to share it on social media, at different educational or organizing events, totally welcome you all to get this out as much as possible. So totally. And then I think I see one more question. Um, Are there labs you can suggest that test osmolality in products?
Well, it's a really good question. There are labs out there that do this. And I'm not familiar, with which ones are good or bad, or, I think osmolality is a fairly easy thing to test for, if you've got the right equipment. For the research that we did, I'll say like we didn't, go and test the osmolality of these products. We are using the data that was provided by companies to the FDA. So we didn't sort of independently verify that information, but we are certainly looking forward to having conversations with some of these lubricant manufacturers, if they have changed their osmolality, or if they have newer results, if this is something that they are concerned about. So I don't have specific examples of good labs that do this, but there are certainly plenty of labs that out there that can do it, and I think it's a fairly clear and straightforward process.
Oh, I think that was all of the questions that folks put in the chat and also that we received by way of our registration. So thank you everyone for asking those amazing questions. I think there's still a lot of work that needs to be done in terms of lubricants, obviously. But we're super excited to like kick this off with like this first ever database that kind of shows and is a visual of pH and osmolality. So we also would like to invite you all to share all of this. And if you want to know a little bit more about Vaginal Health Week and some of the other things that we're doing throughout the week, please feel free to visit our campaign webpage. And then if you want to go to the next slide. Please stay engaged with us. You can follow us on Instagram, Facebook, and Blue Sky and LinkedIn. For those of you that are listening in for this recording, please opt into our newsletters to stay in the loop about anything that we have in the pipeline with lubricants beyond Vaginal Health Week. And then if you would like to go to the next slide. Also, we really want to encourage folks to fill out our evaluation for today's webinar so that we could hear about all of you all's experience today and how impactful that it was. So without further ado, I think that wraps up our What Your Vagina Wants You to Know About Lubes webinar today. Happy Vaginal Health Week, and we look forward to engaging with you all throughout the week and beyond. Thank you, everyone.
Mhm.
Bye.
Thanks so much.